So we're here to again take a look at a little bit of research and attempt to bring it over into a clinical setting. I've been speaking quite a bit about the concept of multisensory integration. So using more than one sense, how those things integrate to help us, and in this case, in some situations, so I want to highlight this because I speak quite a bit about keeping your eyes open and paying attention to what you're doing. So the concept here being something called the crossed hands temporal order deficit or temporal order judgment deficit. Now, I may not be properly saying that as far as what's written in the literature, but the idea being that when you cross your hands and you keep your eyes open, or at least with what has been shown, that when stimuli are applied, so say something happened here and something happened here, my capacity to identify what happened first versus what happened second is somewhat impaired. This has been shown fairly reliably, but what has also been shown a little bit more recently, so I've been taking a look at the research of a PhD that works at McMaster University, Dr. Shore, working with multisensory perception. And what has been shown is that in a situation where the hands are crossed, if you want to minimize the temporal order judgment deficit, so the capacity for somebody to identify what happened first versus what happened second, closing their eyes is actually helpful. So this is one of those situations where if you happen to be crossing your hands, it may be useful as far as palpation is concerned or as far as accuracy is concerned to close your eyes. When your eyes are open in a situation like that, what ends up happening is you have what's called an external reference frame or external frame of reference. When you close your eyes, you're able to remove that external frame of reference. You don't have to use your top-down processing as much. Your capacity to kind of reorder stimuli such that you're more accurate with temporal order judgments on what happened first. So as I'm working here, if I was trying to separate for some reason, separate structures, and I leaned in and I was separating structures, which isn't perfect, it's not really what I'm doing here. This is only to demonstrate the concept, is that this may be a situation where I'll be better off closing my eyes and paying attention to my hands. Is that absolutely the case? No, not absolutely. As we spoke about previously, the frame of the question. So the frame of the question is about temporal order judgments. It's not so much the case in manual therapeutics. The temporal order judgment isn't absolutely the case because really what I'm trying to do is move something. Another way that I can minimize, so we're talking about the fact that within research, we've noticed, or it has been noted, that to reduce the deficit of temporal order judgments or accuracy of temporal order judgments with a crossed hands posture, that closing the eyes refocuses, so you have an internal frame of reference, you're better able to pay attention to your hands. However, if it's just a treatment I'm attempting to apply, what I can do to minimize, or another option to minimize possibly that temporal order judgment deficit, is I can simply purposely move one hand and move the other. Okay? So as I've stated in a previous video, what we're looking at is taking things from research that are within a given frame because the question has been asked in a very specific way and they've collected data from that. And then to attempt to apply it clinically, sometimes it's not a perfect match. What we're speaking about here very simply is that crossing the hands is somewhat awkward. There are a lot of technical or technique-based approaches in manual therapeutics where people cross their hands. If their eyes are open, it's possible that their capacity to palpate accurately may be diminished, at least with respect to what happens first versus what happens second. A way to minimize that when keeping your eyes open, to pay attention to what's happening, is to purposely move one hand, followed by purposely moving the other hand. You have the time. If pressed for time, you may have a different effect, or you may have a different need. If you want to, another way to approach it, simply with respect to the research, is to close the eyes. So we're looking at it, crossing the hands can confuse you. So what you want to do is minimize that. If you have to cross your hands and you want to keep your eyes open, you move very methodically and purposefully because you have the time to do so. If for some strange reason you don't have the time to do that, in this specific case, when your hands are crossed, you may be more accurate or more accurately able to palpate things if you close your eyes. So we just want to be honest and say, keeping your eyes open all the time may not be perfect. There may be some situations whereby closing your eyes and not looking at what you're doing may help you with accuracy, but there are other ways to essentially minimize that effect.